Help, my older baby has started to refuse the breast. Does this mean that they're self-weaning? I get this question a lot. So let's kind of dive into why an older baby may start refusing the breast, some of the most common reasons that I see, and strategies that can help. There's lots of reasons why a baby who's older, meaning 6 months plus, where milk supply is fully established, that's not what's going on, may start refusing the breast. Number one is they could be sick or have an ear infection. Babies have to breathe through their nose when they're latched at the breast. So if they have a stuffy nose or there's some pain while they're latched, they may refuse, but usually you'll figure that out quite quick. Not every baby with an ear infection may show really obvious signs that they have that ear infection, but sickness could be one reason why they would temporarily refuse the breast. Holidays, vacations, anytime baby is out of their normal routine, sometimes this can cause subtle shifts in milk supply, where baby could come home from a trip fussy and not be as content at the breast. It could be because you didn't get adequate nutrition and hydration, they didn't get the number of feedings that they normally do, so supply can kind of shift. There can be some flavor changes depending on what you were eating and drinking while gone. This again should be temporary. After a vacation or a holiday, usually however long you were gone and out of your routine, it could take about that same amount of time to get back on routine. Make sure you're eating and drinking, offering the breast routinely. If baby is refusing, you can always pump to maintain that supply. Another reason, the most common reason that I see, is your period coming back. During PMS, the few days right before your period or during your actual period, milk supply decreases, the milk tastes saltier and flows slower, and letdown can be harder to trigger. So if you have a baby that's been eating fine and all of a sudden is frantic and fussy and arching at the breast, and you feel like there's not as much milk, it's harder to pump the milk, you're not letting down as much, it could be a sign that menstruation is coming back. So those babies, it can be just a temporary refusal while you're in that phase. You may or may not actually have a period. Usually then I see one cycle later, Aunt Flo has come back in town. La Leche League has some great strategies for maintaining supply, reducing that supply drop. I have other videos on that, so if you're curious about how to maintain your milk supply during your period, drop a comment and I will give you that video for what to do. Another reason could be pregnancy. If you get pregnant again, milk will shift back to colostrum at the end of the first trimester and decrease in volume, and it tastes different. So older babies can be really fussy at the breast if you're pregnant. Going on a hormone-based birth control is another big reason why I see babies refuse the breast, for the same reason as periods and pregnancy. It's a hormonal issue. Those hormones can be in opposition of your breast milk supply. And in order to, your body basically, that hormone-based birth control is messing with your supply. So it decreases, it can change the flavor. And so again, baby could be fussy at the breast. I usually recommend go on one round of the mini pill before putting in any kind of IUD, because if your supply does drop, if you have a fussy baby, you could stop taking the pill and choose a different form of birth control. But I do see birth control impacting babies and causing refusals. Other medications, other supplements can also cause a refusal. Extreme exercise and weight loss can also make a baby fussy at the breast, not because it's harming your milk, but going too far into calorie deficit can lower your milk supply, making a baby fussy at the breast because they're like, where is my milk? I want my milk and I want it now. So honestly, anything that can change your milk supply can make a baby more fussy at the breast, which can include going back to work, family stress like moving, divorce, death in the family, major illness, or a sibling going back to school or coming home from being consistently in school. So those are the most common reasons why I see a baby refusing the breast. Remember, it is very rare for babies under a year to self-wean. So most likely, if your baby 6 to 12 months is refusing the breast, there's some kind of reason. Most common reasons I see are periods or pregnancy, medication, and sometimes changes in routine. Most of that has to deal with supply. So making sure that you're maintaining a full, robust supply and that there's no other changes that are going on can be really helpful. Most of the time, breast refusals are temporary, and baby will come right back to breast once whatever that is, you can figure it out. If you are struggling to figure out why your older baby is refusing the breast, don't hesitate to reach out either to myself for a virtual appointment where you can come to my office, or reach out to another local IBCLC who can help you pinpoint which of those things might be going on and some other strategies that we can try. If you are going back to work, make sure you're maintaining supply with a quality pump, the right size flanges, and moving milk frequently enough while you're gone so that baby has something to come back to. So if you have more questions about periods and milk supply, send me a message and I'll make sure that you get that information. And again, if you have any questions with your breast refusal baby, don't hesitate to reach out, lalactation@gmail.com, or send me a message. Now you know.